angle. I am not going to come in here, even though I can hit the dot there. You want to follow the curvature of the face. So I'm going to put it right at that dot, the central ray, the very middle of the PID at the dot without changing my angulation. That's why it's crucial that your patient's sitting straight up. That's the only way those angulations will work. If you lay your patient back, it's not going to work. So let's try that.
Thank you. Whoa, I'm caught on something.
Are you caught?
There you go.
Okay, everyone step back. You guys can see. Oh, error.
The saying the sensor's not
Did the sensor fall off?
connected.
It's connected. You want me to connect it to the computer?
Let me
Try one more time? Yeah, you got it.
Where's my... Let's push it again. Out, Ivan.
Yep. Thank you.
There it goes. So I'm a little too high. Did I get the apex?
Yeah.
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 The apex.
The doctor wants to see if there's an infection in tooth number 2.
What's the whole point of
got it.
being a periapical? Is to get the roots of the teeth. Now the crowns you're going to get with the bite wing. So this is actually diagnosable. Okay? Now it's telling me to go to the premolar. So I'm going to have it open a little bit. I'm going to move it a little forward. Now I'm going to go to the inner campus between the ala and the tragus. So that's my second dot. What's my angulation? Pass it to the next person.
The premolar?
Maxillary premolar.
35.
45?
35?
45?
30 to 40.
So let's try 40. I don't change my angulation, which a lot of you are going to do. As soon as you start angling it, you're going to change your angulation. So let's try 40. Also, I'm not so far back. I'm going to change my horizontal a little bit because now we start following the mouth. Let's try that item.
Okay.
Oh, what is it doing that other day? Oh,
Yeehaw!
it's finding my son.
Oh, well, that's the first one, right?
Yeah, then go
so
to
let me just,
radiation.
I'm going to click OK over here first, because this screen's giving us a message. And,
The full mouth again.
yeah, it's not letting me select it because there's something going on over here. There we go, but it's still giving us that message. Of course it would pick
A demo.
demo to act this way. Okay, let's try it again. Wow.
Let me try the next, the other one.
Okay.
There you go. You gotta get rid of this one.
Okay, I'll be right there. Let me hit cancel. Oh, now it's giving us another one. There we go. I guess it closed Texas completely.
Yeah, when I took the sensor out, it has to restart. There it goes.
Just move the whole thing over there again. More mouth. There we go. Okay.
Next. You already took that one.
Right.
Okay. Step back.
I'm gonna connect it to the computer.
Yeah, it's the sensor. It's not, I'm trying, it's not.
started doing this to us last week too.
Some of these are just, it doesn't just happen to you guys, it happens to us too. You just stop recording?
No, I can edit the video then.
Okay. Well, then you're gonna have to do it in the,
Yeah, no problem. Let's see. Full mouth. Next.
next.
Okay.
Oh, there it goes.
Cool.
My horizontal's a little off, but I got the apex.
Got the root tips.
Yeah, my horizontal's a little off. I needed to go this way. And if I had looked in there and looked the way his jaws are, I would have seen that the horizontal was off. I got overlapping. Okay, so now where is it asking me to go? Way on the other side. So it's set up so that you don't have to keep changing this. So it's set up now to the lower left. So we'll do a couple more, and then I'm going to change to my system because I think this way is so much harder.
Mm-hmm.
So you guys can see the dots. So outer campus, so this is going to be your central ray. If you guys can show the angulation.
Yeah, I'll take it over here.
Mandibular, molar.
Negative 10. So, and this, if it doesn't go, flip it around and turn it. Don't force this. Because if you guys saw the way I was having it, it wouldn't go. So they just flip it. Don't force these things. Negative 10? So it's not much angulation. My central ray, when I'm talking about central ray, it's like if there was an imaginary laser beam right in the middle. I'm putting that to the dot without changing my angulation from my cue sheet. So I'm going to go here, and my central ray is going to hit that dot. Actually, I think it should go a little further back. I've been using this Snapper for 30 years, so I love it. Because I don't like to hurt people. And the XCP can be a little uncomfortable on people. Can you see that?
Nice.
That is a near perfect x-ray.
Because you needed the medial root of number 31, so you're good.
Yeah, I've got all the roots.
Mm-hmm.
Yeah, that's good. It's you can diagnose it.
We got
Now,
from
it's got nuts and bolts and stuff because of him, but it's a near perfect x-ray.
patient's a World War II veteran,
Yeah,
right?
yeah, he's had some reconstructive surgery in World War II, Ivan. Yeah, that's perfect, Ivan. So we're going to do one more, and then we're going to go into the way I take these x-rays. So we're going to go a little further forward for the premolar. So now we're going to do the inner campus of the eye. So it's the second dot. What's the angulation, someone?
Negative 10.
Huh?
Negative 10.
Negative 10? Okay, so it's about the same.
Pass that down so somebody else can see what you're reading yourself.
I'm going to do the second dot. Now when we're talking about the horizontal angulation, you're looking so that central where it goes right in between the contacts. So if I were to do it like this, I would still hit the dot, but would that get the overlapping? Yes. If I were to go like so, it would give me overlapping. So you're trying to go right in between the contacts. So I'm going to point it at the dot, trying to make sure that it goes right in between the contacts. And make sure this is not bouncing like it was a second ago. You want movement. Okay, exposing. Let's see.
Boom.
Got it.
It's gorgeous.
I didn't get enough forward to get the distal of the canine like we like in a premolar, but you can't always get it. But I got everything I needed, other than the distal that came out. Okay. So it is possible to do it with the landmarks. But I have another system that you might like, and that's when we use that sheet that I just made up for you. So now we're going to the upper right. So with this system, you don't use the landmarks. You use this. You use your PID as your guide. So I'm going to set them up, put this in there, and then I'll show you what I'm talking about. When you set this up, you have this little blue line on your snapper. And that's going to be your guide when you place this in the mouth.
I'm gonna just zoom in on that blue line there.
When the patient bites, you're going to have this blue line visible. So when I put this in the upper right, come over here, Ivan.
Excuse me.
The only thing visible when the patient closes is that blue line. And I know when it's in the upper right that the sensor is above and behind that. Okay. So I'm going to put some tape around this thing, around this PID. If you're in an office that you're there permanently, you can actually put dots like little stickers to help you. But since this is not our own, this is not our own place, we're just going to put some tape on here so you can put the dots.